Impromptu Presentation by Katie May. Mary Breckinridge was born February 17, 1881 in Memphis, Tennessee. She grew up in Washington, D.C. in Russia because her father was a minister to Russia and was also a United States representative. Her grandfather was the vice president to James Buchanan. Because of her father's job and grandfather's legacy, she lived a wealthy lifestyle which enabled her to have a private school education. Two of the schools she went to included Rosemont Desailly School in Switzerland and Lowen Haywood School in Connecticut. Breckinridge had siblings and was the middle child, but the eldest daughter. Mary Breckinridge married in 1904, but her husband died a couple years after they married due to appendicitis. This death was one of the factors that influenced her decision to go into nursing. She went to school and was a student at St. Luke's Hospital School of Nursing. Later, Breckinridge then married again, and she had a son and a daughter. However, they both passed at very young ages, with the son dying only a couple years after he was born, and the daughter a few hours after being born. After those tragedies, she then continued, specifically after the death of her son, to leave her husband and serve in World War I as a nurse. In 1918, Breckinridge served as a public health nurse in Washington, D.C. during the flu epidemic. Later that year, she volunteered to go to France with the American Committee for Devastated France. She was in France for 3 years and accomplished much while there, including doing disaster relief and creating a program for children and pregnant women. She also saw over a visiting nurse program in France that was very successful and led to her nurses caring for many pregnant women throughout the country. In 1921, Mary Breckinridge decided to come back to the United States. She noticed the lack of health care as well as proper midwife care in rural areas. Nobody was properly trained on how to care for babies and pregnant women, specifically in the Appalachian Mountains of Kentucky. She was then inspired to go back to school to get a midwife certification. At this time, the only education that was offered for this type of nursing training was in Europe. Therefore, Breckinridge went to England in late 1923 and studied at the British Hospital for Mothers and Babies. And in 1924, she received her midwife certification and went around to nursing stations to learn more about rural nursing with an intent to return to rural Kentucky. In 1925, Breckinridge organized the Kentucky Committee for Mothers and Babies, which later became the Frontier Nursing Service. In 1925, Breckinridge had moved and lived in rural Kentucky. She rode around on horseback and observed the health of others and noticed the poor health of the rural community in Kentucky. These observations inspired the Frontier Nursing Service, which was not only founded but also primarily funded by Breckinridge. The service was designed around a singular hospital, a doctor, and many nurses. The nurses rode on horseback and would go to treat patients. Horseback was the best option because it was the most efficient and effective way to reach people in the rural Kentucky community, considering there was not clear roads, and it was also the easiest way to reach people that were in a mountain region. The Frontier Nursing Service provided lots of healthcare service to rural Kentucky that couldn't be provided before. Europe had training in schools for nurses who specialized in being midwives, but the United States needed a school. The service was sending nurses to Great Britain for training in midwifery, but World War II hindered the ability for nurses to continue to receive education in that manner. This conflict in the Frontier Nursing Service paved the way for the Frontier Nursing University. The university was founded in 1939 and had a midwife-focused education until 1970, when the school also started offering a focus in family nursing, which would lead into family nurse practitioners. Today, the Frontier Nursing University is still a fully functioning college with thousands of current students and alumni. Mary Breckinridge was the director of the Frontier Nursing Service until 1965, when she died. That's a total of 37 years of service. Several more organizations formed from the Frontier Nursing Service, including the American College of Nurse Midwives and the First School of Nurse Midwives, which was the maternity center in New York City. When looking at her health, she had a fall off a horse in 1931 that led her to have to wear a brace the rest of her life. But other than that injury, she lived to be 84 years old and died in 1965. Mary Breckinridge left quite the legacy for other nurses of today to carry out into their careers. And these were my sources.